Tuberculosis, TB, is an infectious disease caused by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs, pulmonary TB, but can also affect other parts of the body, such as the kidneys, spine, and brain, extrapulmonary TB. TB spreads through airborne droplets when an infected person coughs, sneezes, or talks. Symptoms of tuberculosis. The symptoms of TB depend on whether it is active or latent. 1. Latent TB, inactive TB. No symptoms. The bacteria remain dormant in the body. Cannot spread to others. May become active later if not treated. 2. Active TB, symptomatic TB. Persistent cough, lasting more than 3 weeks, sometimes with blood. Chest pain or difficulty breathing. Fever and chills. Night sweats. Unexplained weight loss. Fatigue and weakness. Loss of appetite. If tuberculosis spreads to other organs, extrapulmonary TB, symptoms vary depending on the affected area, e.g., back pain if it affects the spine. Treatment of tuberculosis. TB is treated with a combination of antibiotics taken for at least 6 months. The most common drugs used are isoniazid, INH, rifampin, RIF, ethambutol, EMB, pyrazinamide, PZA. Treatment must be completed as prescribed to prevent drug-resistant TB. Multi-drug-resistant TB, MDR-TB, occurs when the bacteria become resistant to standard antibiotics, requiring stronger medications for a longer period. Who is at risk of tuberculosis? Some groups are more vulnerable to TB, including white heavy checkmark people with weakened immune systems, e.g., HIV/AIDS patients, cancer patients, diabetics. White heavy checkmark malnourished individuals and those living in poor sanitary conditions. White heavy checkmark elderly people and young children. White heavy checkmark healthcare workers who are in close contact with TB patients. White heavy checkmark smokers and alcoholics, as they have weaker lungs. White heavy checkmark people in overcrowded areas like prisons, refugee camps, or shelters. Prevention of tuberculosis. Through BCG vaccine and early detection and treatment through screening and also infection control, wearing masks, good ventilation,